A common question that comes up, particularly in social media, is whether we need intraoperative PTH levels. Some facilities just don't have that capability. My feeling is yes, you always need intraoperative PTH levels. Even if you find 4 normal glands, intraoperative PTH levels can be very useful. There are people with supernumerary or more than 4 gland disease, and you wouldn't know this unless you had PTH levels drawn in the operating room. Now, for a surgeon who performs 4 or 5 of these surgeries a year, the chance of having a single bad gland is approximately 80%, and so the likelihood is they're going to cure most of these patients. But when it comes to high volume surgeons, we know that we see the abnormal cases. You get enough easy cases that you start to have the strange ones. And this is where intraoperative PTH levels really, really help. So remember, PTH has a half-life of about 3 to 5 minutes. So if it starts at 100, 5 minutes later it should go down to 50, and then to 25, and so on. In the operating room, many people use a criteria where the number should drop by 50% into normal at 10 minutes. Personally, I don't think that criteria is strict enough. I've seen numerous cases where the parathyroid hormone levels, say, started at 100, we removed a parathyroid gland, and it stalled at around 45, 44, 42, and we've gone back in and removed a second and a third parathyroid adenoma. So, when it comes to parathyroid surgery and cure, you have to wait long enough for the parathyroid hormone level to drop to an adequate range. Well, what's adequate range is the next question most people ask. That really depends. If you start at 200, oftentimes below 30 or 40 is reasonable. However, what if you start at 35 or 40? Many cases that I operate on are considered normohormonal hyperparathyroidism, as in the calcium will be 10.5 and the parathyroid hormone will be non-suppressed at, say, 35. And in that case, when we start at 35, we expect the hormone level to be somewhere around 10 or 12. You have to be willing to wait long enough in the operating room for this to come back. Unfortunately, this does take as long as 30 minutes per level. So, if we take a parathyroid gland out at 12 o'clock noon, at 12:05, 12:10, and at 12:20, we pull off the parathyroid levels through an IV. Once those levels are drawn, they take about 25 minutes to process in the lab, which provides a little bit of delay. This is the number one reason why people don't like to draw intraoperative PTH levels. It's very inefficient and keeps people under general anesthesia for a long period of time. However, there still hasn't been a better system developed. There are some surgeons who perform 4-gland exploration and then check a parathyroid hormone level in the recovery room. If they haven't cured you, then they bring you back to the operating room to do the surgery again. Now, statistically, this would work out most of the time, and very few patients would have to go back to the operating room. However, you have to have a center and a patient that's willing to do that.